Hello, I'm Gabby Deck, and I'm an anesthetic technician here at Nelson Hospital. So I work in the operating theaters. So we come in early in the morning, and the first thing we do is start getting our machine check done. So the machine you see behind me, that's our baby. It's about a 20-minute check, and so we get that started. And then we make sure we have all the equipment we need for the day. And then our anesthetist comes in and we chat about our plan, because we'll have a list of patients. And then we begin operating. So we assist anesthetists with intubating the patients. We stay with the patient the entire surgery, and then we help wake them up. So we do that several times a day, depending on what operation we do. And then at the end of the day, we tidy up and make our workspace nice and clean. I chose to become an anesthetic technician because I had previously done a course as a wilderness first responder, and I really enjoyed it a lot more than what I was studying at the time. And I'm like, I think I want to go into medicine. So I was looking at the different options, and I knew I wanted to be in theater. And so I stumbled upon anesthetic technician, and then I'm like, yep, this is the thing for me. And that's how I ended up here. What I enjoy most about our work is definitely working with all sorts of people. I love the team atmosphere that we have here. When you see theater, it just flows so well. Everyone knows their role. And then when you get a team working really well together, it's just like magic. Here at Nelson Hospital, we do shift work in theater, and we also do on-call as well. So we don't have a designated night shift. We have a theater team who can be within 15 minutes of the hospital, but they might get called in at the night, which does keep life really interesting. I quite like the variability of what we do, because we're not only in theater. We sometimes go to ED, we'll go to radiology, MRI, different places throughout the hospital that ICU, we respond to different emergency situations. And there's quite a bit of variety in our work. So from day to day, you might be doing a C-section in the morning, and then in the afternoon you might be doing a hip replacement. There's just really good variety of different types of surgeries that we do. Nelson Hospital has 6 operating theaters, and that's actually relatively small compared to some of the bigger hospitals that may have like up to 22 theaters. There's a lot of advantages to working at a small hospital. Like I had said before, we are quite a small team, and so it has very much so a family feel here. I've actually just come back from maternity leave a few months ago, so I've had a year off work, which has been a wonderful time with my baby boy. And I'm so lucky here at Nelson Hospital. I'm able to have a good work-life balance, which is really important as a young mom. So I'm able to work 2 days a week, do a wee bit of on-call, occasional weekend, but actually the majority of the time I get to be home with my son. So I kind of get the best of both worlds. I get to use my mom brain, and then I get to use my medical brain. Which I really enjoy, actually having a break and coming to work. But I'm just really lucky. There's actually a lot of parents of young children who work here in Nelson Theaters, so everyone understands where you're at, and there's a lot of grace for that as well, which is nice. What's so great about becoming an anesthetic technician is you can have a background in anything. And it's good for all ages. It's not just for young students coming out of school. It can be for older people as well. I studied originally in the States. I have a Bachelor of Science in Outdoor Education, which is completely different from becoming an anesthetic tech. But as I had said earlier, I did a wilderness first responder training, and I just fell in love with it. So I decided to pursue anesthetic teching when I came here. But I was an older student in the group, so I went back in my mid-20s, and it doesn't matter how old you are, just go and do it, because it's such a great career.